the whole lecture of today will be on the liver function test, right? The is commonly used in the humans for diagnosis of liver condition, as well as in animals. It is being used for the liver abnormalities detection. If liver has some problem, then this liver function test is can be used in the animals, right? So in very first slide, we have 3 stacks of cube on top of each other. Actually, this is a representative, right? So whenever we are
यहाँ से कुछ क्लिक करना पड़ेगा नहीं नॉट
मैसेज डाल दीजिए सर. Can you see the PowerPoint presentation? Just type a message.
So this
yes, it's okay.
So we have 3 cubes on top of each other, which is compartmentalization. Whenever we are discussing liver function test, we are, for example, jaundice, we are going to explain it in the 3 compartments, like pre-hepatic, hepatic, and the post-hepatic, likewise compartments. So this one is just representative. So today's content is ELFT, liver function test and recommendation. Then symptoms of liver disorder, list of liver function test, liver anatomy, jaundice, liver functions, classifications of liver function test, and differential diagnosis. So liver function test, it is also known as a liver chemistry. It helps in determining the health of the liver. So whenever we are doing liver function test, means we are measuring the level of the protein, liver enzyme, bilirubin, etc. in the blood, right? So liver function test. So whenever, for example, bilirubin, so we have red blood cell in our blood, right? So every 120 days, these cells dies, red blood cell dies. In spleen and reticular endothelial system, they will be region broken down into the heme compartment and globin compartment, and this heme, it will be converted into the bilirubin. So this we will be discussing in the detail in the further slides. So in which condition liver function test is being recommended? It is recommended to check the damage of the liver in the infectious, like so it can be used in the liver infections like hepatitis B, hepatitis C. In case of certain medications, for example, if you are giving acetaminophen to the animal, in that case, the liver, this liver enzyme concentration, ALT, AST, it may increase. It may be important to, if you are giving treatment, to monitor the side effect of this these drugs on the liver, right? So that's why we can use this liver function test. Next, to monitor the treatment of liver disease. If you are doing the treatment of the liver disease, you have to monitor treatment, how much the treatment is effective and how much it's still pending. For that purpose, we are using this LFT test. Next, if you are seeing some symptoms of liver disorders, Next slide, we will see that. Then also you can go for this test. If animal have certain medical conditions like high triacylglycerides, if patient have diabetes, high blood pressure or anemia, in these conditions, this liver function test can be performed. In case of humans, if somebody is drinking alcohol too heavily, in that person, the many times doctors will go on checking your liver function test, right? Next is a gallbladder disease. If some problem is there in the gallbladder, then this liver function test is being performed. The symptoms of the liver disease disorder. First one is a jaundice. Jaundice is a yellow skin and eyes. You can see the sclera of eyes become yellow, the skin become yellow, the mucosal membrane become yellow. That is the liver disorder, jaundice. Next is a fluid collection in the abdomen known as ascites. This ascites is one of the drawback of the liver disorder, because the liver is producing a lot of protein in our body, and one of the function of this protein is to maintain the osmotic pressure. So we have a lot of fluid inside our circulatory system, and we want to keep that fluid inside our circulatory system. We don't want that fluid to go outside and accumulate in the tissue site, right? So these functions are being done by the albumin protein. For example, this protein will help in the maintaining the osmotic pressure in the blood, right? Because of that osmotic pressure, this fluid doesn't oozes out inside the body cavities. If this liver has some problem, you will have ascites, because lesser albumin means more protein oozing out into the body cavity. Next, discoloration of the bodily discharge, dark urine or light stools. So we have already studied in second year of BSc, right? So why urine has yellow color? Because there is a urobilin pigment in the urine, right? And why feces has brownish color? Because of stercobilin. So basically, whenever RBC is breaking down, it is breaking down into bilirubin, and bilirubin is being converted inside the intestine into the urobilin, and this urobilin get absorbed in the bloodstream, it excreted in the urine, gives the yellow color of the urine, and because of bacterial action in the intestine, this urobilin is can be converted into the stercobilin, giving the brownish color to the feces. Next, animal may experience the nausea, vomiting, diarrhea, abdominal pain, abdominal bruising or the bleeding. These are also the symptoms of the liver disorder. Why animal will absorb may show the bleeding? Because liver, most of our proteins which are present in our body are being synthesized in the hepatocyte. So we have, in order to stop the blood from clotting, blood from oozing out, we need a clotting factor. If this where this clotting factor are being synthesized, these are synthesized inside our liver. So we have liver damage, it means clotting factor are less. Clotting factor are less means we have more bleeding. Okay. So in this one, we have this liver function test. Albumin, which is synthesized in the liver, the albumin to globulin ratio we can see. Actually, all these component we are showing, we have to see the concentration of these proteins or enzymes inside the blood, right? Albumin globulin ratio, ammonia, it has to be excreted. The liver has a excretory function in the metabolites that we will see. Alpha-1 antitrypsin, this enzyme level we can measure. We can measure the bilirubin, total, direct bilirubin, and the indirect bilirubin we can measure. Then we can measure the bile pigments in the urine. We can measure the bile salts in the urine. Serum cholesterol. If excess of serum cholesterol is there, the excretion of this cholesterol can be done by the hepatocytes. So if this cholesterol is excess, it means that some liver abnormality is there. Coagulation time, the prothrombin time is there. Normally this prothrombin time is 9.5 to 13.8 second. Coagulation profile. So it is an early marker. So based on the half-life of the component, we can have the early detection marker or the late detection marker. For example, the prothrombin has very shorter half-life, so it can be used in the detection of the acute hepatic damage. If you have a higher half-life components, you can use it for the detection of the chronic hepatitis, right? So next one is a ceruloplasmin level. This level decreases in the in case of Wilson disease, where copper toxicity is present, and this level can be checked for the liver function as a liver function test. Bromosulfaphthalin. So this one is a liver excretion test. We will see if something is given to liver, and if it is a foreign object, the obvious function for the liver for foreign object is to detoxify. We have to get rid of these molecules. For example, bromosulfaphthalin is there. We have to get rid of this bromosulfaphthalin. If you are giving 5 milligram per kilogram body weight bromosulfaphthalin, we expect that about in 45 minutes it should get excreted from the body. So you measure that bromosulfaphthalin in the blood, whether it is still there or not. And if it is there, it means that your liver is not functioning properly. You need to look after it. Next enzyme marker is SGOT, SGPT, LDH 4 and 5. These are the enzymatic markers. Next is obstructive pathology, alkaline phosphatase, gamma glutamyl transferase is there, 5' nucleotidase is there. Next is a ferritin is there, phytoprotein is there, alpha phytoprotein. This alpha phytoprotein is supposed to be higher in case of the fetals, but fetal development. But in adult also, if that level is higher, it indicates that some liver dysfunction is there. Next, we have globulin molecule, lactose tolerance. So one of the function of the liver is to metabolize the things. If we are giving galactose to the patient, we expect that galactose should have been metabolized within 2 hours. If it is not being metabolized, it means that liver is not functioning properly. Next is a hippuric acid excretion test. Like many drug molecule, hippuric acid also combines with some drug molecules and it gets excreted. So that test we can perform for liver. Heptoglobulin is there. Next we have HBs antigen. If you have hepatitis A, hepatitis C, hepatitis B infection, in that case, any infection is there means antigen is there. Antigen is there, it means that you will have antibodies. Whenever you have antibodies, you can go for immunological test, right? So you can detect antigen, you can undertake the viral immunological test for viral infection. And some cases you have to go for ultrasound. So this one is not biochemical test, but if you have some obstruction in the biliary duct, in that case you have to go for you can go for ultrasound and you can detect whether there are some stones or caliculi in the bile duct. So that was the just introduction to our topic. So before going to this topic, we will go one by one. We will start with liver anatomy, just as a refreshing. Liver, we can see liver here. So this one is a liver. We have right hepatic duct, left hepatic duct. This hepatic artery supplies the oxygenated blood to the liver, and we have gallbladder here. So whatever bile is produced inside the liver, it will go through this bile duct, this green color bile duct, and it will accumulate in the gallbladder. The function of the bile acid is to help in the digestion of the fatty acid. Next, we have duodenum, intestine here, bile duct. So whatever circulation, whatever nutrients we are eating, one of the function of this nutrient is it will go into the portal system, hepatic portal system, and from hepatic portal system. So this one is a hepatic portal system. So all these nutrients molecules, it will be carried towards the liver. So all our nutrients gets carried by the hepatic portal vein, and as you can see, it is a venous blood supply. So it is a deoxygenated blood supply. Little bit oxygen has been decreased, and this blood supply also comes from the spleen, right? So as we already discussed that inside the spleen, after 120 days, RBC get broken down and it will start producing the bilirubin, and that bilirubin has a lot of implication in this liver function test. Next, we have liver. Liver, whenever we say liver, we have to click that this one is ALT, AST, alanine transaminase, aspartate transaminase. These are the metabolic functions of the liver. So we have one amino acid and it has to be transaminated. We will see it. So these are the enzymes mainly present in the liver. Next we have is a ALP GGT. ALP alkaline phosphatase and the gamma glutamine transaminase is present in the gallbladder. So this thing is there. And one of the whenever we are detecting liver function, why not one test? Why so many tests are there for the detecting liver function? Because there is always uncertainty associated with the liver function test. Means when we have ALT, AST, the ALT is specifically synthesized in the liver cell. AST can be synthesized in the liver, heart, muscle. So if you have damage to the muscle, you will have AST increase. If you have ALT increase, means very likely that your liver has some abnormality. But AST is not that specific. Likewise, in case of ALP, it can be found in the bone, kidneys, liver. If you have some damage to the kidney or some abnormality with bone, then you will have this ALP increase. That is why we need a differential diagnosis. One test for all is not there in this case. If somebody has a lot of alcohol consumption, gamma glutamate transferase level increases. Next, this is a structure of the liver. Liver has a lobules. We all know that this is a hepatic portal triad. Hepatic portal triad. So this one is a hepatic portal triad. The bile duct is there. Branch of portal vein is there. Branch of hepatic artery is there. And the portal vein and portal artery, this will be emptying into this central vein. It will feed into the hepatic vein. And we have sinusoids. So from this vein and artery empties into sinusoid, and all these nutrients are going towards this central vein, and this central vein will be going toward the aorta, and it will be reaching into the heart, and nutrition to the all body components will be there, right? So that is there, and this blue color we can see this IgA synthesis, secretory antibody synthesis will be there. It is needed for the mucosal immunity. Then complement system is there. So whenever immunity is being initiated, we have classical complement system, alternate complement system, lectin complement system. So all this complement system, if it has to work, we need a complement. So pathogen is there, it has to bind with antibody, then complement has to bind, and then it can destroy the pathogen. In immunology, we have seen that. So these complements are being synthesized in the liver. So that is why it is important. Next, we have albumin. Albumin is a carrier molecule for many things like fatty acid, drugs, even for our bilirubin. In case of bilirubin, this is a molecule which carries this unconjugated bilirubins towards the hepatocytes. Next, we have the serum proteins, other serum proteins like clotting factors and most of things, whatever required as being synthesized in the liver, right? So sometimes people call it as a kitchen of our body. Everything is being synthesized inside the liver, most of things. So next is a liver function. So the function is a synthetic function, includes the synthesis of albumin, cholesterol, prothrombin, triglycerides, lipoproteins. Next is a metabolic function. Means under biochemistry we have seen a lot of pathways, right? So many pathways they're located in the liver. For example, glycogen synthesis, it occurs in there. Gluconeogenesis, if you are in a starving condition and you need a glucose, in that case fat, proteins, it has to broken down, it has to get transformed into the glucose. That thing, this gluconeogenesis, this happens in the liver. Then regulation of blood glucose level. Fatty acid synthesis and oxidation, that happens inside the liver. Then synthesis of triglyceride, cholesterol. So we saw the removal of cholesterol happens in the liver. Synthesis here as well happens in the liver, right? Triglycerides and cholesterol. Protein, catabolism of proteins happens in the liver. Detoxification, ammonia metabolism, bile pigment formation, cholesterol duct, that has to got detoxified. So this we say, for example, these are not good for body, so we have to get rid of this one. So this excretory function, this happens in the liver. Next, we have vitamin A, D, E, K storage inside the liver. So whenever we are taking nutrient, sometimes we have to store the things. So these storage things happen in the liver. Next, iron and glycogen, this storage, it happens in the liver. So iron and glycogen storage, it can happen in the liver. Next, aspartate transaminase. So we saw in the case of liver, there is a ALT-AST enzyme. So that is a transaminase enzyme basically. So if you see the PDB viewer, some protein structure is basically 3-dimensional structure like this, but we don't go for that structure. But basically the function of this enzyme is that we have one amino acid and we have alpha keto acid. For example, amino acid is alanine and this one is alpha ketoglutarate acid. Then what happens is that this amino group from this alanine molecule get transferred to this alpha ketoglutarate and it get converted into the alpha it get converted into the pyruvic acid plus glutamic acid. So that is the transamination ALP. Likewise, in case of SGOT, we have this oxaloacetate plus the aspartate plus alpha keto acid, and it will produce the oxaloacetate plus glutamic acid. So next, synthetic function. Urine has a yellow color. We already discussed it is because of this urobilin pigment. Next, atherosclerosis. If cholesterol is not being excluded from the body, then it start accumulating inside body, and we will have atherosclerosis. So now it is the one thing is leading to other things. The liver affection is leading to the cardiac dysfunction, right? So atherosclerosis one of the leading cause of this cardiac damage. Next, we have secretory antibodies. This secretory antibodies is there. It is being synthesized. It is exclusively synthesized inside the hepatocyte. So this mucosal immunity, very essential for mucosal immunity. So whenever we say liver metabolites, already we discussed, we have glycogen. Glycogen synthesis is there. Glycogenesis is there. Glucose, glycolysis can happen here. Cholesterol can synthesize here. Fatty acid can get synthesized. Triacylglycerol can get synthesized. Then if you are hungry and you are not eating anything, the fatty acid will break down into the ketone bodies. Your keto brain requires a lot of glucose. Around 20% of our energy need is required by glucose, and we can't keep it being stored for a long time. So fatty acid can get converted into the ketone bodies, and it will supply the immediate source for the glucose. Now this glucose, it can be used for synthesis of protein. This amino acid, it can undergo the gluconeogenesis and it will synthesize the acetyl-CoA. So a lot of complex metabolism is there. Anabolism and catabolism, the synthesis and breakdown things are there. Likewise, we have urea cycle. If you have ammonia, excess of ammonia which is being produced because of the breakdown of the protein molecule, it will be converted into this urea molecule, which can be easily excreted from the body. Next function is our detoxification. Toxins are there. It can be excreted via phase 1, phase 2, this transformation, and it will be excreted in the feces and urine. So basically, your liver can act as a trash can, right? If your trash can is working properly, then your this toxin molecule and everything can be trashed out inside that trash, right? That is a detoxification function. We all know whenever we say the function of liver, everybody talks about jaundice. So we have the yellow sclera and yellow skin is there, discoloration or yellow discoloration. So jaundice, whenever we talk about jaundice, we talk about prehepatic, hepatic, and obstructive jaundice. The prehepatic jaundice, here excess of hemolysis is present, increase of feces pigmentation is there, color of urine is yellow, index, icteric index is yellow to moderate, low to moderate, increase unconjugated bilirubin followed by conjugated bilirubin within 3 to 4 days due to stress on the hepatic excretory system. It can be seen in a protozoal infection, pyroplasmosis, anaplasmosis, hemobartonellosis, babesiosis. If animal has a equine infectious anemia, clostridial hemolyticum infection, leptospira, some chemical phenothiazine, copper, nitrobenzene. If snake venom is there, snake bite is there. Incompatible blood transfusion also leads to hemolytic anemia. We all know the plant poison, post-parturient hemoglobinuria, congestive heart failure will be there. So we see here babesiosis. For example, babesia is a parasitic infection, but basically the parasite is multiplying in the RBC and it may cause the lysis of RBC. And RBC lysis, hemolysis, heme release inside the body. So basically this one is a different slide, sickle cell anemia. If hemoglobin is releasing inside the blood, it has to undergo the bilirubin transformation. Likewise, in Babes cirrhosis, it has to undergo the bilirubin synthesis. So this one is the synthesis of bilirubin pathway. Heme is there, heme oxygens leads the biliverdin. Biliverdin gets converted into bilirubin by biliverdin reductase. Now this bilirubin travels from the spleen to the blood. So traveling molecule is we have truck, this albumin truck with us, which carries bilirubin, and it carries it to the liver. So inside the liver there is a UDP glucuronil transferase molecule is there. So bilirubin combines with bilirubin, this glucuronil molecule, and we get bilirubin diglucuride and monoglucuride. And then these molecules get transferred from the liver into the bile duct to get converted into urobilinogen, urobilin, and stercobilin. Stercobilin gives the brown color, and this urobilin yellow color to fishes. Sometimes in case of humans, this glucuronil transferase is absent, so it gives the Gilbert disease in that one. So unconjugated bilirubin level increases. So same pathway. So bilirubin unconjugated combining with this albumin, conjugated bilirubin we have. So urobilin, excreted, likewise. So whenever we say that we have stacked the three things on each other, we are seeing where our symptom is occurring. If it is in blood, some problem is there, hemolysis is there, unconjugated bilirubin increases. If in liver some problem is there, conjugated as well as unconjugated bilirubin you can see increase. If some problem is there in excretory pathway, for example, this one is a bile duct and some obstruction is there, it means that already this unconjugated has conjugated with the glucuronic acid, and now this conjugated bilirubin has increased in the blood. So basic, this is the basic concept of this one. Hepatic or the toxic jaundice, increase in both conjugated and unconjugated bilirubin is present in this one. So biphasic reaction, we say Vandenberg reaction. Color of the feces is a normal, color of the urine is an intense yellow, icteric index is a moderate. Chemicals, we see the chloroform, carbon tetrachloride, phosphorus, it leads to the hepatic damage. Neoplasm, hemangioma, metastatic carcinoma, metastatic sarcoma, it causes hepatic damage. Bacterial tuberculosis of liver, pyogenic hepatic abscess. Then infectious canine hepatitis, nutritional. If somebody is eating a lot of fatty acid, lot of fatty diet, that people's liver will start to grow in size, and people will have hepatic liver, right? Fatty liver, and this fatty liver leads to the activation of the iota cell of the liver, and this iota cells basically the normal housekeeping function, but it undergoes some gene expression changes, and it will lead to the fibrotic lesions. So liver will undergo a lot of fibrosis. Likewise, in case of people drinking a lot of alcohol, the fats start accumulating, and it will be leading basically to the lot of fibrosis of the liver, and basically leading to dysfunction. Anorexia condition also leads to the hypoxic injury. So if somebody is drinking a lot of alcohol, we expect this person's liver to be like this on the left side. It will have a lot of nodules. Basic function is that healthy hepatocytes should be there. Healthy hepatocytes are replaced by the fibrogenic fibrogens, and now these are not working properly. People are likely to die of this disease if not taken care of early. Next, we have chronic hepatitis, cirrhosis. So chronic hepatitis is there, cirrhosis, later stage. Sometimes people have the cancer. So this one is a cancerous lesion. It is growing inside the liver, and it causes this disease. The stages of hepatic damage. So this is your normal liver. If you are not taking care of animal or this one, the fatty liver, fibrosis is there, and liver is undergoing the cirrhosis. Next, liver, if some excess of iron, mainly in case of, for example, in his human case, this iron is accumulating inside the liver, and hemocytosis is present. Ascites we discussed can be present here, and it leads sometime in human patient we have to insert the catheter, and we have to take out the fluids. So this one is the procedure for this one. Post-hepatic obstructive jaundice, biliary passage which could be intra or extrahepatic or both. Conjugated bilirubin regurgitates into the bloodstream. So by direct Vandenberg test, color of feces will be gray in color, urine will be intense yellow, icteric index will be high. In case of atresia of bile duct, canaliculi, inflammation of bile duct passage, cholangitis, cholecystitis, carcinoma of the bile duct, this condition. So if something is having problem in this one, if some obstruction is there here, so the conjugated bilirubin increases, right? So this one is a gallbladder, and now this one is the amino acid glycine taurine linked with the bile acid, and we are getting the taurocholic acid, glycocholic acid. Likewise, these are the bile salt accumulation. You can detect its presence in the urine by the G-Mullerian or Faucett test. So classification based on biochemical classification, we have bilirubin, bile salt, urobilin, bile pigments, enzymatic, glycogen tolerance, prothrombin, albumin, globulin, AG ratio, protein, AFP, liver dysfunction. We already discussed this one, right? Bilirubin, bile pigment, the enzyme marker are there. So this one are our test. We classify it into the serum enzyme, ALT, AST, alkaline phosphatase, GGT, 5-UNT, excretion, bromosulfatylene, interest index, bilirubin, Vandenberg test, Faucett test, G-Mullerian test. Based on synthetic function, we have serum albumin, alpha fetoprotein, prothrombin type, uric acid, and galactose tolerance. So interest is basically how much is the yellowishness is present. So this is basically outdated test. It is not much used. Vandenberg test is there. It is sulfonylic acid combined with sodium nitrate, act as a diazotized reagent, which will give the purple color in case of direct reaction. In indirect reaction, unconjugated bilirubin doesn't dissolve as such. So we have to dissolve it with the help of the methanol molecule. Then only after 30 minutes it will give positive. And biphasic reaction, you wait for some time and then put methanol, we get positive results. That is a biphasic hepatic damage. Bromosulfatylene excretion test, prothrombin already we discussed. So differential diagnosis. If AST is high, ALT is normal, you can suspect muscle damage. Already we discussed because AST, its origin is from muscle also. Liver disease, mostly ALT is increase in case of increase than AST, relative concentration. But in alcoholic diseases, this get reversed. IALP and normal GGT, extrahepatic origin, bone diseases can lead to this one. Jaundice, if symptoms are like this: jaundice, anemia, increased unconjugated bilirubin, you can expect the hemolytic jaundice prehepatic problem. Sudden increase in ALP and GGT means hepatocellular carcinoma, GGT, alcohol. Then jaundice, increase unconjugated and conjugated bilirubin, increase ALT, AST, ALP, increase or normal hepatocellular damage or hepatic problem. If you have, for example, this is mostly in case of humans, right? If fever is there, right, upper quarter pain is there, jaundice is there, dark urine is there, increase ALT, AST 400 to 4000 international unit per liter, mild ALP is there, ALT greater than AST, viral hepatitis. So next one is acetaminophen toxicity is there, means you will have higher ALT and AST and mild ALP increase. Alcoholic steatosis is there, means we have very high ALT and AST will get generally less than 400. Obstructive jaundice is there, it means that ALP and GGT are increased in this way. Biliary pancreatitis. Pancreatitis means ALP increase because it is synthesized from biliary and lipase is synthesized from the pancreas, so pancreatitis. So these are the serum biochemical parameters. So this one is important because whenever we say something is less or something is higher, we have to know what is normal. So this one is a normal. For example, total protein 6.474 gram per deciliter. It is normal. If we consider it as a normal, anything higher than that one is increased, or lower than that one is a decreased concentration. So we compare it with it, right? And it has some other implications also. So whenever we say bovine, canine, equine, or any other species, it is sensitive to the species-specific variations, right? If some canine dog is there, one Chihuahua is there, another dog is there. So it may have some normal is different for the different species, right? So normal for one species may not be normal for another species. So you have to know these things. So this was you are not expected to use it as blindly as for the clinical investigations. You have to apply your own judgment, right? Next, you have conclusion. Liver analytes are specificity is dependent on tissue of origin. Liver function test can be divided into synthetic, metabolite, as well as excretory function of the liver. different metabolite used for assessing is can be based on the half-life of metabolite. So whether acute liver damages are or chronic liver damage is there, that is dependent on half-life of metabolite you are analyzing. Liver jaundice is classified based on pre-hepatic, hepatic, or post-hepatic origin. Then comparison of LFT with normal value is sensitive to the medications being used and the species. So species we discussed. So sometime you are giving some medicines to an animal like acetaminophen or some non-steroidal anti-inflammatories, and you are measuring its liver function. So sometimes this drug itself leads to increase in the concentration of the liver enzyme. So you have to be careful when using this these things also, right? So, and these are the references, and here is a disclaimer. So presentation is intended for informational and educational purpose only, right? For clinical investigation, you should apply your own mind and search the information again properly. Okay, thank you very much.